My dear viewers, Assalamu alaikum. Today I'd like to discuss one of the most important topics in human being. This is called congenital hypothyroidism. Hypothyroidism is two types. Remember this. One is congenital hypothyroidism, another one is acquired hypothyroidism. Acquired hypothyroidism, another name is juvenile hypothyroidism. Congenital hypothyroidism occur at the birth, but juvenile hypothyroidism occur at children and adolescent and adult people. Remember this. Now, what is the etiology? What are the causes of the congenital hypothyroidism? Congenital agenesis, degenesis of the thyroid gland, number one. Number two, defective biosynthesis of the thyroid hormone. How defective biosynthesis of the thyroid hormone? Its answer is a defective iodide form and defective oxidation of the iodide to iodine and defective organification, defective oxidative coupling of the DIT MIT within the thyroglobulin. One molecule of MIT and one molecule of DIT form T3 or triiodothyronine, and one molecule of DIT, another molecule of DIT form tetraiodothyronine or thyroxine. Remember this. Now, the question is that how the patient is present to you at birth. At birth, the understanding, diagnosis of the congenital hypothyroidism a little bit difficult. How we can see the general appearance of the patient. The appearance of the patient will be, it is first of all you see the appearance. Appearance is that is first of all you see a coat spaces with wide open anterior and posterior frontally, and wrinkling of the forehead with low hairline, undue prolongation of the physiological jaundice, and delayed passage of the mucinium. Remember this. Large protruded tongue, which interferes with the feeding and respiration. There is a noisy respiration. Abdominal distension with umbilical hernia, and the choking spell during feeding. Remember this. Cold, mottling skin, and there is a hypotonia. Short neck. Neck will be short due to deposition of the fat over the supraclavicular region. And another one is your edema of the both extremities and genitalia. Another thing you remember this, the linear growth, slow linear growth. That means upper segment, lower segment remaining in the infantile. Remember this. Now, how you diagnose this? How confirm the diagnosis? Diagnosis is only clinical diagnosis, but sometimes we did some laboratory investigation for confirmation of the diagnosis and differential diagnosis. What are the investigation? We go for assessment of the thyroid hormone T3, T4 and THS. T3, T4 will be reduced and THS will be rising in congenital hypothyroidism. But T3, T4 and THS both are the remaining in below condition. This will be the secondary hypothyroidism. Remember this. Then bony age assessment. Bony age assessment by the X-ray of the both knee joint to see the lower femoral and upper tibial epiphysis will be absent. Remember this. Next, thyroid gland will be scanning, and there is a ultrasonography of the thyroid gland. It should be remembered this one. Next, we go for what are the treatment? What are the treatment of the congenital hypothyroidism? Congenital hypothyroidism treatment is levothyroxine should be given 10 to 15 milligram per kg per day. Lifelong supplemental should be given. Now, how the assessment should be done every month for 6 months, then every 2 to 3 months for 2 years. Remember this. Now, how the thyroid screening should be done. Thyroid screening should be done day 5 to up to day 15. This time thyroxine T3 T4 assessment. This is the one of the more importance to thyroid screening. Now how are the counseling? Parents counseling. Parents counseling should be done about the natural history of the disease and its outcome. Regular follow-up of the respective physician at least for 2 years. Thank you very much for patient hearing. Thank you.